Secret number 1. So since college, I've been suffering from a skin condition I thought was just a bad case of dandruff or balakubak, because not only was it unresponsive to ordinary anti-dandruff shampoo, the flakes were also found in my ears, my eyebrows, my eyelashes, the sides of my nose, my femtouch, or pinong balbas sa babae, and my cheeks. I later learned that it wasn't just a simple case of balakubak. It's known as seborrheic dermatitis. And I noticed that all of my siblings have it too, and we inherited it from our mother.
So, si mama po pala ang nagpamana nito sa amin lahat. Sabi niya, nung pinanganak kami, lahat kami may cradle cap. This is seborrheic dermatitis in babies. Cradle cap is greasy, yellowish, scaly rash that commonly affects infants in the first few weeks of life. Para po siyang madilaw, minsan brown na sebo na may kasamang flakes or kaliskis sa ulo ng baby. It may result from the hormones in pregnancy, yes po, nung buntis si mama, or pass through breastfeeding nung pinadede niya kami magkakapatid. It is harmless and it usually disappears after a few months of treatment with oils and shampoos. So, nawala naman siya. It disappeared at about 3 months of age, according to mama. But then, it returned again at adolescence, around the teenage years, because of the hormones of puberty. So, it can be largely influenced by hormones. The first hormones from the mother and then hormones in puberty.
Seborrheic dermatitis results from excess oil production, para kang may factory ng sebo sa muka, leading to overgrowth of yeast in the skin which feed on the excess oil. The yeast has a name. We call it Malassezia furfur. Anyway, the yeast is a normal flora of the skin, meaning may titulo po ang bahay niya sa balat. Hindi po siya NPA. Legal po siya, nakatambay talaga sa balat. Normally, they are harmless tenants, but due to the excess oil, they overpopulate. Medyo napahayo sila at nagparami dahil sa oil. This overgrowth then leads to an immune response. Syempre, mag-react si skin natin. However, the response is also abnormal in that it is a hyper response, may pagka-overacting. And this is manifested as redness, irritation, itchiness, and flaking of the skin. The flakiness or balakubak is not ordinary. If you try to remove it, it is very adherent. Hindi madaling tanggalin. And if you manage to peel it, it will be raw. It may weep or have pinpoint bleeding. Imagine, makati siya. Kapag binalatan mo, masusugat at magdudugo. Kaya ako nagkapeklat sa gilid ng ilong. That is how I got these dark areas on the side of my nose. The constant scratching and peeling led to the darkening of the skin.
But I noticed that it's more persistent and involves larger areas of the body among my brothers. My brothers, being men and having male hormones, secrete more oil. This is because the male hormones has a big influence on the sebaceous glands, which are glands that secrete the sebum or the sebo oil. They have more oil glands, and the hormone make the oil glands more active.
There are several things that trigger a flare-up. Mas malala siya kapag hindi nakaligo. That is right, if you miss a bath, or if you just take a half bath, meaning you don't shampoo the hair. And it is a hard truth, but the longer you stay out of the shower, the more itchy it is. The flakes turn into giant flakes and larger areas are involved. Another thing is, even when you take a bath but use the wrong shampoo or use the wrong facial wash, you are bound to get the flare. Hindi ubra yung pambansang shampoo at pambansang sabon. You need an effective anti-dandruff shampoo and a mild facial cleanser that does not dry the skin. Comment, what do you think is pambansang shampoo or pambansang sabon?
Anything with alcohol is a culprit. Toner with alcohol, perfumes with alcohol, anything fragrant with alcohol, they all dry the skin and they all trigger a flare. So, bawal na bawal po ang may alcohol. Next, stress can also be a trigger, believe it or not. Not getting enough sleep, grieving over a loss, or worrying about a difficult situation can predispose you to a flare-up. What else? Cold, dry weather can trigger a flare. Napansin ko ito nung nagpunta kami sa malamig na bansa gaya ng Japan at Amerika. Lastly, according to studies, diet can also be a trigger. Although hindi ko gaano napapansin. Some of these may include dairy, egg, some nuts, and some citrus fruits. So be careful about what you eat.
I have learned more about the condition when I took courses studying to be a skin physician. Nung nag-aral ako, mas naintindihan ko pa itong sakit na to. Marami pala siyang kamuka. It can look like psoriasis, eczema, tinea, at marami pang ibang sakit sa balat na mapula at makatirin. Finally, while in dermatology, I finally learned the techniques to control it and lessen the incidence of flare or attacks. These I shared with my brothers and sister also. And we compared the results with some of the products that we use, and we are sharing that with you now. So there are two approaches to treatment, and both are equally important. You have to engage in both of them. One is self-care practices, and the other is pharmacologic treatment. Mag-work po ito ng maayos kapag pareho niyong gagawin. So let's start with self-care practices. First, it's good to reduce stress. Get a good night's sleep and eat a healthier diet. There is no undermining the importance of these measures in any skin condition. They always go a long way to improve any skin condition, especially sebderm that's often associated to stressful work and a stressful lifestyle.
Next, take a bath at least once daily. Make sure to shampoo your hair and wash your face, including the ears. Mild cases of sebderm can go away with common anti-dandruff shampoos which contain zinc pyrithione or selenium sulfide. Keep these shampoos as maintenance shampoos, which you alternate with stronger medicated shampoos in case of a flare. We also have tried tea tree shampoos and other herbal shampoos like moringa. Those can work for you too. I've tried coal tar shampoo but stopped it because I didn't like the smell. So the technique is to apply it, leave it on for 5 to 10 minutes even in the beard area and ears. Yes, wag po munang banlawan. Iwan ng 5 hanggang 10 minuto bago banlawan. That way, you're sure to get the benefit of the shampoo, especially if they are medicated ones. We then use either a conditioner or a moisturizing shampoo afterwards para hindi po dry na dry yung buhok. Also, keep in mind that it's better not to choose shampoos that are too fragrant as they contain more alcohol and more chemicals that may irritate your scalp. Alcohol to medium to carry fragrance, but it's the #1 enemy of sebderm. Anything with alcohol can dry your scalp and your skin, so avoid them.
One very important thing that you should never forget is moisturizer. After taking a bath while the skin is still damp, apply a good moisturizer. I've tried a lot of moisturizers and some are really good but they're expensive. So this one I really like and stuck with it and even prescribed it to my patients. It's called Bepanthen Sensi Daily Moisturizer. The thing I like about it is it works for me. Maybe because of the prebiotics that is unique about it. You don't have that with other moisturizers. The other thing is that it is a very big size tube. It's 150 grams and I've been given a free sample when I attended a Bayer sponsored symposium last September last year and I couldn't believe it, but I still have that tube and it's been almost a year of usage. It's really getting your money's worth if you purchase it. So use the moisturizer twice daily after taking a bath or washing your face. Next, in line with this, if you have sebderm in the body, use mild hypoallergenic lotions for the body, or you may apply mineral oils or olive oil, castor oil for the scalp at least once or twice a week to keep it from drying. It is best to massage it to the scalp before bed and then cover with a head cap and rinse in the morning. So now we're done with self-care. Now we go to pharmacologic treatment. We usually use medicated lotions, creams, and shampoos for a flare or first-time patient or recalcitrant cases. The most common are steroid creams or ointments that you can use on the scalp or the face or the body. Please do not self-medicate as wrong use can lead to side effects. These are used sparingly, meaning manipis lang po ang bahid, and also intermittently, meaning hindi po matagalan at tuloy-tuloy. Different classes of steroids are used for the different areas of the body. Iba po gamit sa anit at iba rin po sa mukha kasi magkaiba po ang kapal ng balat dito. Antifungal creams or shampoos can also be used. My favorite is ketoconazole. So during a flare, I use it every day until symptoms improves and then I use it once or twice a week for maintenance. There was a time when I was still young and had serious bouts of sebderm that a doctor prescribed me antifungal oral medication called itraconazole, and it was very expensive for me that time. It did help, but now as a doctor myself, I rarely recommend oral meds to my patients as they have more side effects, especially sa atay and the fact that they're very expensive.
Lastly, for some people who cannot shampoo daily because of their hairstyle and their hair type, like my black friends, it's generally recommended to shampoo at least once a week. Some shampoos can be detrimental to black curly hair if used too often. And this is secret number 2. One time in medical school, I did sport cornrows and hair extensions on my head for a week. Can you imagine? So being around many black friends, I had 2 of them braid my hair, which took about 8 long hours, and it was a very great experience. Going around town, being mistaken for a foreigner, having to touch my hair to see if it was real. Totoo ba yan? Pahawak nga, were some of the queries I got. It was supposed to be worn for a month, but I didn't last long in it because it was getting itchier by the day. I was advised not to wash it. So, in hindsight, I learned that as a substitute for daily washing, a pomade made of fluocinolone in oil can be applied daily on the scalp. Another one can be moderate potency steroid ointment once or twice a day for a period not longer than 3 weeks.
So there you have it. Those are some of the measures that me and my brothers have tried and tested. We have seen worse days, but you can see from the pictures, and when you see me personally, you won't know that I had said derm unless I point out to you my dark marks. It has been a very long journey, but we finally settled to the regimen that works for us individually. I hope you learned something new today, and please comment down below, like and subscribe, and see you again in my next videos.